nose today. This is my Pphc Osce, also known as a blood nose. So today I've been dispatched to this young lady with a blood nose that has not yet stopped. Over 15 minutes. I've got my PPE gear on, and she was just out in the heat, and this just came on. But it's about moderate. It's not too bad, but it hasn't stopped yet. I've done my sample history, which nothing significantly has come back yet. She's on no anticoagulant medication or any others. She has no allergies, no other medical conditions to do with this. And she's had them before, but not quite this bad. But okay, so she's going to need some IN adrenaline in each nostril. So I'm just going to prepare my adrenaline. So what I'm going to do is draw up 9 mils of saline and 1 ml of adrenaline, which is 1 milligram in 1 ml, which will make a 1 in 10,000 solution. So I'm just going to check my expiries on here. So this is sodium chloride 0.9% 10 mils, which expires on the 11th 2020. Can you check that, please?
Yes, sodium chloride 0.9%, 10 mils, expires 2020.
Great. And this is adrenaline 1 ml in 1 milligram, and that expires on the 11/1/15.
Yes, adrenaline 1 milligram 1 mil, expires 11/2015.
Cool. Cool, so I have just drawn up 2 mils into each of these of my 10 ml adrenaline solution, which I'm going to administer to my patient. I'll keep my hand over it. Oh. Great, so I'm going to just give you today some adrenaline up your nose to stop the bleeding. Right, it has vasoconstrictive effects to help tighten up those blood vessels. So if you could just give your nose a big blow first, please. Then I'm going to squirt them up each nostril really quickly. It'll just be a fine mist going into your nose.
Okay.
Fantastic. Thank you. And I'll do the other side in a moment. I'll just snake down this side. Great.
I've already done it.
And if you could just hold that on your nose for 15, in that time I'm just going to reassess vitals, and then after that we'll just check if it's still bleeding.
Okay.
So it's been 15 minutes, and it appears that nosebleeds actually ceased for a wee while. So my patient's actually just told me that she's going to go down to her GP's now just for a routine checkup, so we probably don't need to transport her. Just going to go through my non-transport checklist. So my patient's been fully assessed and vitals are all fine. There's none that are abnormal. She isn't showing any signs of serious illness. There's no red flags present. She has been mobilising from when we came in, which was fine. And I'm just going to give her now an explanation of some advice of self-care. So if you could just avoid hot showers as well as hot drinks, and avoid blowing your nose for as long as possible now. And if it gets much worse, you can call us back, but you're going down to your GPs anyway. And I'm just going to give her a copy of paperwork and advice that I've given her. So this is my headache Osce. I've just been dispatched to a mild headache, which I've been speaking to my patient just now, and it came on while she was outside just in the heat doing some yard activities. So I've done a sample history on her. She hasn't got any allergies, no medications, no other health issues that we've found yet. Her vitals are all within normal ranges. She has got a few sort of cold flu-like symptoms, but they're very minor, which are likely to have brought on her headache today. She's got a history of getting them when she does have a cold or flu coming on. She said it was about a 4 to 5 out of 10 pain at the moment. She passed her fast test with no sort of neurological deficits, we say. So I'm just going to do my practical assessment on here. So do you mind if I just touch behind your neck?
Sure, that's fine.
Do you have any pain at all when I touch anywhere here? follow my finger. You can touch my finger where I go. Right. I'm just going to have a wee look into your eyes. My pupil torch, if you just look straight ahead. Yep. And they're all pearl and they're reacting well. So, face. Can you squeeze my hands for me? Yep, so they're both equal. Can you hold them out in front of you? Yeah, looking good. Cool. Can you poke your tongue out for me? Yeah, no, she did that well and has good facial movement as well. So, I'm just going to go through my headache checklist to make sure she's got no red flags. So she hasn't had any head or neck pain following manipulation, no stiffness, no temperature, no vomiting, nothing neurological so far. She hasn't had an altered level of consciousness, no anticoagulants, no hypertension, on here, and I don't believe this is during any sexual activity. So I'm just going to give her some pain relief. She's got no allergies today. So I'm just going to give you some ibuprofen and paracetamol. Is that all right with you?
Right, thanks.
Right, so I'm just going to give her 400 of ibuprofen and 1.5 of paracetamol. Sorry, 1 gram of paracetamol, some water. If you'd like to have them. And I previously checked the expiry with my partner on those. So it's no red flags. I've seen her mobilise, she's been walking around. I'm just going to go over my non-transport checklist. So she's been fully assessed, she's looking quite well, she's had some pain relief, no serious illness or injury, no red flags. She had a green flag just with her cold-like symptoms, but they're okay. Seen to mobilise. And I'm just going to explain to her that if it gets much worse, she can either call us back. If it still stays mild, she can go and see her GP. Yeah. Great, so thank you for joining us again. This is my orthopaedic Osce. The scene we've been dispatched to is we've had a patient who has fallen over and had a fall, so a fall on outstretched hand. She was just walking around her lounge and tripped over a mat. So I've gone over her vitals, they're all within normal ranges, done a sample history, that's come back fine, no medical conditions, no allergies, no medications, it's all reasonable. So I'm just going to check her wrist here compared to the other one. So I've got pulses on both, they're both the same colour, they're both warm. Great. And I've got equal cap refill as well. Now what pain would you call that out of 10? 5? 5? So it's quite painful. Does it feel broken to you?
Maybe.
Yes. Now I can see a small deformity here, but yeah, that looks quite painful. Is it more painful when I push it? Yes. Okay, so I'm gonna transport her because I believe that is actually a fracture. So we'll give her some pain relief and I'll put on a sling. Some oils first. Also, are you happy to have paracetamol, ibuprofen and tramadol?
Yep.
Now I've drug checked these previously with my partner. That's a 50 milligram tramadol, 1 gram of paracetamol and 400 milligrams of ibuprofen. Cool, so I'll just give you those to take.
Thanks.
Great. Cool. And she's also had no contraindications to any of my medication or to have Entinox. I'm just going to give her a quick coaching on this. So this is Entinox, it's a pain relief. If you could just take about 5 deep breaths on that, and you'll hear the valve clicking as you breathe in. Takes a few to work. Yep. Yep. It's 5 deep breaths, and then after that, just keep going as you need it. I'm just going to put this on here. nice and elevated. She's had ice on it as we arrived. So Fleur, are you able to wiggle both of your fingers at all? Just a wee bit. And this one.
Oh.
And are you able to lightly squeeze my hands? Cool, so you've got reasonable strength and movement in there. So en route I'm just going to keep reassessing that there's no colour changes. Keep reassessing the pain as well. Make sure no bleeding, it doesn't become compound or anything like that, and keep it well packaged so it doesn't move around. Thank you for joining us again. So today we've been called out to someone with back pain. So I've had a wee chat with the patient already, and what she was doing was she does suffer chronic back pain, normally sits at about a 2 out of 10. But today she was out gardening, which she doesn't normally do, and she was doing quite vigorous gardening, and just felt it pull a wee bit, not traumatically, but it slowly got worse and worse as she carried on gardening. So now she's sitting at about a 6 out of 10 pain, and she called the ambulance. It hasn't spread anywhere, it's quite localised. She believes it's just an exacerbation of her chronic normal lumbar back pain. I've gone through a sample history with her. She hasn't got anything else apart from that. She normally takes paracetamol for it, but hasn't in the last 4 hours. She's got no other medical conditions, no allergies, no other meds. So do you mind if I just take a wee look at your back? And I looked at it earlier just to check for bruising and redness, but I'm just going to have a wee feel. Is there no pain up here?
No.
Just a wee bit in here, is that right? Yeah. Is it worse when I push on it?
Yes.
Alright. So can you wiggle your feet for me?
Yeah.
You can push against my hands and pull against them.
Yeah.
Pull, and you can feel my hands on both sides.
Yeah.
And you can feel me touching your toes.
Yeah.
Pull. You can bend your knees up. Yep. You can squeeze your hands. The deeper sits. Cool. And this is quite normal for you to have pain down there.
Yeah.
Okay. So, I don't believe she needs to go to hospital today, but we'll give her some pain relief to get by. I'm going to give her 400 milligrams of ibuprofen, 1 gram of paracetamol, and 50 milligrams of tramadol, which I drug checked previously with my partner, so if you'd just like to take them. Great. So I'm just going to go over my lumbar back pain checklist, just to make sure she's got no red flags. So she hasn't lost any bladder control, doesn't have a fever, no abnormal vitals, no pain in the chest or anywhere else, no abdo pain, no altered sensation, both her legs are fine. We're going to check her mobilisation in a moment. No other illness, no pain radiating down the legs, she's not immunocompromised or history of cancer, no other pain, no weight loss, no osteoporosis or no other drug use. So are you happy to stay at home today at all?
Yeah.
Yeah. So if it gets worse, are you happy to go down to your GP so you've got someone who can drive you down there?
Yeah.
Yeah. Okay, so if you stand up, we just have to check that you can walk before we leave. Alright. Quite painful, so if you can just take a few steps around. Great. So you're quite steady on your feet. Does that feel quite okay standing? You happy to walk around the house like that?
Yeah, sure.
Great. Cool. So I'll just take a copy of my paperwork and give it to you in case you do have to go to your GPs, but I think you'll be good.
Excellent.